All right, so right ventricular infarction, I was thinking that it was saying that both of these were happening in this one. However, they're separate. So lateral infarction and then right ventricular infarction. So this is right ventricular. We're going to see it in lead 1. We're going to see it in B1. And we'll see where else we see it. All right, so look in here. Lead 1. Nope, don't see it. 2. 3, we definitely have it in 3. So 3 is a mark. AVF is a mark. It's down here. Yeah, I guess because the ventricle is lower. That's probably why. V1. So we do have it in V1. For some reason, it's not in lead 1. Must be getting those mixed up. V3, V2. And these are lateral. We wouldn't see that there. This is popping up. V4R. V3, V4R. Why is it showing that extra one though? There's like 4. All right, moving along. So other cardiovascular conditions include 2 conditions that may produce ST segments. Elevation mimicking acute myocardial infarctions. We have benign early repolarization, almost always a coincidental finding on an EKG, characterized by ST segment elevation, a J or fishhook appearance at the J point, and concave ST segment morphology. Often exclusive to left precordial leads, V4 through V6, and inferior leads. There's going to be no reciprocal changes whenever we're looking at these. So this figure shows a 12-lead electrocardiogram that is showing a benign earlier repolarization. And where do we see the early repolarization? That means it should, there it is. So you see the little nick right there, early repolarization. Same here in V4, V5. And I'm just thinking about the pain in my knee right now, so let's see if it said that, V4 and V5. Yep, V4 to V6, often exclusive to the left pericordial leads, but do we see it in V6? I don't see it in V6. Could be hidden, could not be there, but at least it's in V4 and V5. All right, pericarditis. Patient presents with positional chest pain, often alleviated by sitting forward. They're going to have shortness of breath, history of recent infection or fever. Characterized by diffuse ST segment elevation not exceeding 5 millimeters that is present in multiple leads, and a depressed or downsloping PR segment. The PR segment is elevated or upsloping in the lead AVR. The ST segment is a concave and reciprocal ST segment depression, which is never seen. This figure shows a 12-lead electrocardiogram showing pericarditis. So if we look at AVR, let's just look at what looks abnormal in this. Kind of a little bit, that's normal. That looks normal-ish too, except right here, that looks like elevation. You know what? That is elevation in 1. This looks normal. Kind of a hump there. AVF. That's normal. That's normal. That is not normal. That's going the opposite direction. V1. So we got some elevation here with early repolarization, and elevation. So when you have multiple elevations, that's whenever it looks like pericarditis, because it's happening all around the heart. Yeah, V1, V2, V3, V4, V5, V6. So characterized by diffuse ST segment elevation, not exceeding 5 millimeters that is present in multiple leads, and a depressed or downsloping PR segment. PR segment is elevated or upsloping in leads AVR. Did we see that in AVR? Yes we did, right here. Identify non-cardiac causes of EKG abnormalities such as pulmonary embolism, acute intracranial embolism, and electrolyte abnormalities and genetic disorders that affect the heart. So pulmonary embolism, this can be identified by the presence of an S1Q3T3 pattern. S1Q3T3 pattern. Forget the mnemonic for that. Deep S wave in lead 1, deep narrow Q wave in lead 3, and T wave inversion in lead 3 as well. New right bundle branch block, ST segment depression in leads V1 through V3. We're looking for a lot of things here. Thorough physical exam to other pertinent information is crucial. So just to say it again, deep S wave in lead 1. Deep narrow Q wave in lead 3. Also in lead 3, T wave inversion. And a new right bundle branch block, ST segment depression in leads V1 through V3. So let's just look for that. V1 through V3, ST depression. Yes, that is janky. ST depression and ST depression. And then we have an S wave in lead 1. So it comes down. Yep, you can see it. It looks like an S wave, like so. Also, you have two, I guess that's the RBB. So it's two, let's see, right bundle branch block. You're going to see on V6, I believe. Well, really you see it everywhere. You see, you see the rabbit ears, not necessarily here. So 2 notches mean that the right ventricle is firing twice, once, 2, double tap. And yeah, you see it in AVL2, also in 2.